Welcome to Fit Pro Foundations, the podcast where you'll hear fitness professionals provide the ideas and the inspiration behind their success. My name is Karen Salenzi, and today it is my pleasure to introduce Jeff Tareta, one of the directors of Canada's national program Prescription to Get Active. Jeff is a visionary management professional and certified co-active coach with over 25 years expertise in the recreation, fitness, and wellness industry. In his role as program director for Alberta's chapter of the national program, Jeff has developed a unique service delivery model to better connect the primary care industry with recreation and fitness professionals in order to prevent and treat many different chronic conditions through the prescription of physical activities, ultimately leading to improved overall quality of life. Jeff, welcome to the show.
Thank you very much, Karen.
So, Jeff, what can you tell us about the current state of health of Canadians and where you see that headed?
Engaging in regular physical activity is one of the major determinants of health. And studies have demonstrated that the benefits of exercise in the treatment and prevention of most common medical problems seen today. It is clear that patients who engage in physical activity and a fit quality of life live longer, live healthier, and live better lives. In Canada, 80% of the people are not getting the recommended amount of physical activity to realize the needed health benefits, which is an issue. The cost of physical inactivity is about $12 billion per year. And when you add obesity on top of that, it's another $19 billion in terms of cost. So cumulative, that would be about $30 billion a year. And so based on the prevalence, the reach, and the health effect of physical inactivity, many have suggested that physical inactivity is the major public health problem of our time.
That's very significant. So, you've talked about a couple of figures here. So 80% of Canadians are not getting the recommended dose of exercise. So that number there, are we talking about the 150 minutes of vigorous cardiovascular activity or the 300 moderate to vigorous?
Well, what we're looking at there, and the benchmark is through CSEP and the Canadian Physical Activity Standards. So for adults 18 years and older, they need 150 minutes of moderate to vigorous physical activity per week. And for children and youth, we're looking at about 60 minutes per day of moderate to vigorous activity.
And it's interesting because, of course, with the pandemic right now, both of those numbers are going to be skewed significantly. So am I to understand that this was a problem before we even entered into the pandemic? Are we truly in that bad of physical shape?
Yeah, and these stats, Karen, were taken before the pandemic occurred. And, during the pandemic, it's my understanding just through some reading that of course, mental health is becoming more of an issue, but people are less active during the pandemic than they were prior to the pandemic as well. With gyms being closed, less access to recreation complex, those type of things are leading to that.
What can you tell us about how Prescription to Get Active works? And I'd love for you to dig deep into how it works from the perspective of the healthcare system, participating facilities, and what it means for the individual.
Sure. So Prescription to Get Active is a not-for-profit corporation, and we have chapters in Alberta. We have a little smaller presence in Ontario in the Markham region, and we're just starting up in Manitoba. But essentially, we're a connector between the primary care, the healthcare professionals, and fitness and recreation professionals. We provide a specialized prescription that healthcare professionals can provide to their patients that are not meeting those Canadian physical activity behavior standards that I mentioned earlier. And they do a little bit of counseling with the patient in terms of how physical activity could benefit their overall treatment in terms of reduction of chronic disease, in terms of prevention or treatment of many chronic diseases as well. So what would happen is that someone would take this prescription, as you get a prescription from your doctor for for example, pills, and they would register their prescription on our website. We find out a little bit of information about the patients that come our way that way. And then we open up a whole menu of opportunities for people to get physically active. And it ranges from opportunities to go to local fitness and recreation facilities to try out those facilities for a period of time, gives them an opportunity to develop a relationship and start to gain some of the benefits that come along with being more physically active and to start to exercise. We also have online programming where people can, especially during the pandemic, do physical activity in the safety of their homes. They can start to develop some confidence around how to move effectively and so forth, all taught by qualified instructors. And we're also working on a community no-cost, low-cost initiative, which would allow people to go out in the community and say play basketball or volleyball, maybe go to a walking group, somewhere where some types of activities that they would really enjoy doing. And so they would get started with that. What we also offer is right now remote behavior support. And that means people registering for an app. It's called Go Get Fit. And you would put in your goals. You put in your schedule of how many days a week you want to be active. And then what happens is that you get notifications on your phone about, it may say, Jeff, you've got a walk scheduled for tomorrow, get your shoes by the door. So it's a reminder that way. And then when that schedule has passed, say a day later, it sends you another note saying, did you do your walk and record how you felt and how hard you worked. So you're able to take that information and see it over time. And then there's motivational reminders. If you haven't scheduled something for the week, it gets you to put in that schedule. And so it's really been effective for me to use because it doesn't take me a tremendous amount to get motivated, but I find that this app is really helpful for me to maintain a regular level of physical activity. So along with that, we also are working on an activity coaching model. And this is something that we're really excited about because physical activity changing behavior is not easy, but changing your behavior to a more active lifestyle is sometimes a little bit more difficult. And I think the people listening to your podcast can probably attest to that. And adherence rates aren't really high for people maintaining their physical activity. So what we do is we have qualified coaches, and they also would have a background in physical activity, really being in the corner of patients who register with the program. So they would meet with them to do an introduction and set things up in terms of what are their goals for physical activity, why do they even want to start, what are some of the major barriers to physical activity, what can they do to help keep them on track. And then they go through coaching sessions where people have some homework in terms of scheduling a physical activity or getting started and set up to do a physical activity. And then really engaging in what was the learning from that, homework, supporting and championing people to maintain their level of fitness after that. And the key to this is that the coach really is instrumental in not so much exactly what to do, but to be there to support the participant in their self-esteem and their ability to get into action. And those are two key components. And then what we're looking at is having that relationship for about 4 sessions. And then there may be an opportunity for patients to engage in either working with that coach on a longer term if they like, and it would be a paid for service, or also getting involved in maybe group coaching where it's fairly low cost to be involved in that, but they can be part of a group and part of a community. So we're piloting that activity coaching coming up here in the next month to 2 months. Other than that, it's not a complicated program, Karen. It's really quite a simple program as well. It's been effective in the past. We've done some surveys self-reported by the people who have gone through the program. And it's really quite positive in terms of people using this prescription really to get engaged in physical activity. And, over 80% have said that it's really had an impact on them becoming more active. So we're really happy with where prescription to get active is going, and I'll leave it at that.
That's fantastic. And I mean, you couldn't have a more timely event and solution, because if these were the numbers that we were dealing with before, or let's say in 2019, we know that there's the demand for something like this is going to be so much greater. So I want to jump back to this. You touched on what happens in the healthcare system. Let's say that I was the individual that needed to have assistance or guidance around my health. And is this something that the doctor would necessarily recommend, or would I have to, as the individual, print off the information and take it to the doctor to have them fill it out?
Well, you can do it both ways, Karen. And I would say that if you are interested in the program, certainly ask your doctor about the program to make sure that they are our prescribers. But what we're trying to do is get physical inactivity to be part of the vital sign, just like heart rate and blood pressure would be, or sometimes your doctor asks you if you are a smoker or not a smoker, but asking, are you active? And if so, how many minutes per day and how many days per week, to try to get to that for adults, 150 minutes per week and moderate to vigorous. And if people are below that, then they could engage in a conversation that, have you ever thought about physical activity? We notice that your blood pressure over time has been going up. You got a couple options. You can become more physically active, and they can talk about the benefits of that, and that there really is no side effects to it. Or we can put you on blood pressure medication, which here's some of the implications of that as well, and people make choice in doing that. In terms of prescribers, it's not only just physicians. They do about 40% of the prescribing, but also allied health professionals that work closely with doctors and nurse practitioners can be prescribers as well. So as long as they have a clear line of sight to the person's health history and know that they do not need clinical supervision to exercise, then they can be prescribers as well. We call it a dedicated practice relationship.
This is great. You brought up a very important point here. The individuals that are engaging in prescription to get active, they have to meet a minimum health requirement. Is that correct?
It is, and that minimum requirement is really determined by the healthcare professional, and that is that the person is healthy enough that they don't need clinical supervision. So you could go out and you could go for a walk or start to jog, or you could do a swim, those type of things, and there's no real safety concerns health-wise that you have to worry about. So they they do screen you for that before they recommend the program through the providing you the prescription.
This is exceptional. I'm so glad that we're having this conversation today. Let's say that I'm an individual who's currently not getting the recommended amount of exercise per week. I've heard of this program. I take it to my doctor. My doctor fills out my exercise prescription. Then what? You touched on the fact that there's a couple of different options, but how do we know who the participating facilities are, and everyone in those participating facilities, are they aware that this exists?
Well, absolutely. So as soon as you get your prescription, Karen, what you would do is it indicates that you should register on our website. So it gives you the website web address there, as well as if you don't have a computer, and in this day and age, it's kind of hard to believe, but some people don't. They can give us a phone call, and our phone calls there, and we can walk them through that, let them know what's available in their community, what other resources there are. We can send them some resources, those type of things. But for most of the population, they would register on our website. They can take a look at, if they want to go to a facility, there's a map. So it says enter your location. So you would put in, we're in Calgary, so we could put in Calgary, and it gives you all kinds of little dots on a map where we have relationships with facilities, in this case, as providers. And all you have to do is look at the map and say, hey, I live in the southwest part of the city. They click on one of our providers there, and it brings up information on the right-hand side about what the offer is in terms of if it's 30 days free trial or if it's 10 free visits, like with the city of Calgary. But it also allows them to, there's a link there right to the website, the facility website, and they can do a little bit more research. So in this example, if they want to go to a facility, they've found something on our website that's they're going to want to try. They take their prescription into the facility. All the staff there that are members of Prescription to Get Active will know what to do with the prescription. And so they welcome them. They find out more about what the person's interest is. They let them know, they take them for a tour, they tell them what programs are available to them, and they follow up with them towards the end of the trial just to see how things are going. And ideally, they maintain a relationship during the trial. But, we have on average about 20% of the people who use facilities convert to members or buy supplemental services like personal training, those type of things. And we've had as high as 33%, just depending on the experience as well. So although those numbers don't seem tremendously high, that's usually what happens in the population anyway. You get a reach rate of between 15 and 20%. So it's pretty good, but people also have opportunities to try other things on the website when they register as well, like an online fitness program, and they register for that, and they could access video on demand videos it could be 5 minutes, could be 10 minutes, could be 20-minute videos, all taught by professional instructors and certified instructors. They can, with some of them, you can filter that by the type of instructor, the type of class. It could be yoga, it could be a HIIT class, it could be, a strength class, those type of things. So, there's thousands of videos there that there should be something for anyone as well. So that's a little bit about how it works once you get the prescription.
Can't see how anyone would not jump at the opportunity to take part in this, either as an individual or a facility. Because let's say that we've got an individual that lives in a rural setting where they're not close to any gyms. So you're telling me that they could have access to qualified fitness professionals through a prescription that their doctor wrote online. They don't even have to leave their house.
That's exactly right. And that was one of the challenges that we had early on with Prescription to Get Active. We were quite limited by having our facility partners, but for those reasons you just mentioned, we've had to expand that to allow access in rural populations as well. So yeah, you don't need any equipment to do the types of activities. There's beginner level program, and most of them are focused on beginner level programs as well. And it's worked out pretty well.
That's wonderful. How is it that more Canadians are not aware of this? Because this program has been in existence for about how long?
10 years. It started in Alberta and Leduc in 2011. So I think to your question, why don't more people know about this? There's a couple factors here. One is that only about 16% of physicians will prescribe or are prescribing physical activity. And that was kind of shocking to me. And I went to a conference, it was an exercise medicine conference in 2019. And I asked a question about why so few doctors prescribe physical activity and exercise. And the key message is that they don't get a tremendous amount of training on how to prescribe physical activity. So they don't feel 100% confident in that. And a study was done by Dr. Jonathan Fowles. He's with Dalhousie University, and he's the chair of exercise medicine. They identified that when people, before training, the physicians in the group were 20% of them would prescribe, and their confidence level was only around what they said, 20%. When they went through the training session, and this was a one-day training session from Exercise Medicine on how to prescribe the direct benefits of exercise on certain medical conditions and such, that number after the training went up to 73% confidence level, and that 73% would prescribe on a regular basis. It's a matter of training. It's a matter of making the program very simple for physicians to use and allied health professionals to use as well. It can't take a lot of time, and we continue to work on that. We've made some significant inroads with that. The other part is that for us in the past has been someone dedicated in my type of role on a full-time basis. We've had funding through the Alberta government, and then it's gone away for a little bit, and then it's been resurrected again. Now that we have some consistency in terms of funding, we're working more on developing awareness through our social media. We have a new video that's going to be released in the next week or two on what is prescription to get active, and all those things that you and I are talking about in a very short, compressed time period. I think it's just about 2 minutes. We'll start to create some of that awareness as well. We're working and going to be in partnership with Go Get Fit and Dr. Peter Rozick, and he has a network of professionals that use his product that will be informing them of what we do as well. So I think it's a matter of the education and the willingness to prescribe, but also creating awareness in the population that has been, I guess, is improved over time, and it will even get better after this. So more and more people will be aware of the program. But I think the key is that letting people know about the program, and them, you can go on our website and see what clinics have a prescriber and see if your clinic is actually doing that. And if it is, great, you can have that conversation. But even if your clinic and your doctor don't, you can ask them about the program, and we can send a person information about our program that they can give to their healthcare professional as well to help the process.
Wonderful. Now, you spoke about a Dr. Peter Rozick. Is
Yes.
that the doctor that was involved in creating the app that you spoke about earlier?
Yes, Dr. Peter Rozick is a emergency room physician in Red Deer. And for the last 5 years, he's been developing that particular app to help support people in their physical activity journey.
And that's the one that will give you reminders about to go put your shoes by the front door and to get things ready. And if they don't happen to log in a workout, will they get a gentle reminder or a little check-in through that app?
Absolutely. Yeah, absolutely.
I think I need that app.
Yeah. Well, and to build on that as well, if I can, Karen, there's the user side of the app. So someone like you and I could sign up for the app, and we would get all those wonderful services that I've spoken about. But there's a professional version of the app as well that you can subscribe to. So not only healthcare professionals can use this, but also fitness professionals can use it as well. So as an example, if you have 100 personal training clients and they're using this app and they're recording their activity, it will automatically send you reports on maybe who's falling down from their schedule and exercise routine, and you can draw upon 100 different messages that you want to send either to the group or to that individual in terms of encouragement, support, those type of things as well. And you can send that on the masses, and that keeps you in contact with your clients, even between, say, your personal training sessions.
So in addition to being able to send out automated messages, you can also customize it for each individual person. Is that correct?
Absolutely.
Wow.
Absolutely.
This is exceptional.
And they have some education pieces on there as well. And, they have, they've really done a good job. They're always in development of this app. And they're not only in Alberta, they're scaling across Canada, but they're also in the eastern seaboard of the US, in the Boston area, as well as they're in Australia. So they're really, it's really starting to catch on in terms of a support mechanism for professionals to use, but individuals to use as well.
And what's the name of the app?
It's called GoGet.fit.
GoGet.fit. How
Yeah.
wonderful. I'm very excited and curious to see all that this app has to offer. We've talked about the steps that the individual would go through, and we've talked a little bit about what their experience will be. But what about for owners or operators that weren't aware of this program? Because from what I can understand, not only is it very altruistic, I mean, it's getting the people in our lives, in our neighborhood, in our country fitter, or have the ability to stave off potential chronic diseases down the road. I would think that there would also be some opportunities for building business for some of the gyms or facilities that may not have even been aware that this was in existence. Would you agree?
I would agree. And just to build on that, we have 145 what we call activity members with prescription to get active. And we're always looking for more because we want to customize this to the communities and give people different options and opportunities. Some people are just getting off the couch and they're ready for something fairly gentle, those type of things. It could be a walking group, it could be just some easy low impact stuff, all the way up to people who are have just fallen off the wagon and they are interested in more vigorous type of activity, of course, doing that over a little bit of time. But what we offer is the ability for facilities to apply for membership to prescription to get active, and they can contact me at Alberta at prescriptiontogetactive.com and just say, hey, I'm interested in your program and being a member of it. We would send them an application form. They'd fill it out. It gets vetted through what we call a chapter, and those are healthcare professionals and fitness and recreation professionals in the community to take a look at these. And if we have more questions, we circle back and ask those questions of the owner or the manager of that facility. Then once it's approved at that level, it goes to our national level, and usually once the chapters approve it, the national level does as well, but it's just another set of eyes. And then we send out a membership agreement. Once that gets signed, we go through an orientation about how the program works, and we provide the resources and materials that you'd want to have in your facility to create awareness of the program. The key is that we're trying to provide new leads to fitness and recreation facilities. We don't, in our policies, we don't allow people who in the facility see it say, hey, I want to drop my membership, take advantage of this free trial, and then get on to membership again. That's not what it's all about. So it would be new people coming into the facility. So members might have a family member, they might have someone that they know, a coworker that would really benefit from physical activity. And if they really like the gym that they're at, then they can say, hey, why don't you ask your doctor about this program and go through the free trial, and we go from there. So it's been wonderful that way in terms of for the facilities to generate some traffic, and God knows we need that. Many are of course shut down, but after the restrictions get lifted as well, I mean, we need people coming in and getting involved in the business again, for sure.
It's very compelling. Would there be any fees associated for the facilities to apply to be one of the facilities involved in prescription to get active?
Yeah, well, actually, the answer is no. There are no fees, and that's the beauty of our program. We're a not-for-profit. We're funded through Alberta Mental Health and Addictions, and crossing our fingers that we're refunded through Alberta Health. We're just sort of waiting on that. So it is a public good type of program to get more people physically active and really reduce barriers for both not only the participants but also recreation fitness facilities as well, and our online partners and communities as well.
I truly, honestly do not see any downside to this program. Now, you mentioned 145 facilities. Is that Alberta based or is that participating across Canada?
That's Alberta based. So we have about another 30 facilities in Ontario, and we have none. We're just starting up in Manitoba. Actually, this week we had our first conversation. So that's where we sit.
So you are the program director for the largest and most influential chapter thus far. Is that correct?
Yes, that's correct in Alberta. I mean,
well done, Jeff.
well, and I can't take all the credit for that. It was developed over time. I think the founders of Prescription to Get Active really had, a fantastic vision for how they can get people more physically active and do that through partnerships with primary care and fitness and recreation, because primary care doesn't understand, not that they don't understand, they don't have the same skill set as someone who's a certified fitness professional or has a kinesiology degree as well. There's so much expertise that lie in having those certifications and those degrees. As an example, it's hard and it's unfair for us to imagine that for example, doctors will know everything, right? They know a tremendous amount, very bright people, but in terms of the how to program for physical activity based on people's needs, how to motivate people, they just don't have the time, right? And fitness professionals and recreation professionals have that time, they have that expertise. So we're developing trust between healthcare professionals and fitness and recreation professionals that they're willing to pass along their patients to us to be able to take care of these folks and have them improve their quality of life and prevent and treat chronic conditions.
That's wonderful. Now, I think that this is a really good segue back into a coaching position because, of course, Jeff, everything that we've talked about so far, we've talked about how it can benefit facilities, how it can benefit individuals, how it can benefit the Canadian healthcare system. But what about the individual fitness professionals that are looking to build their business and they are now aware of this wonderful program? Can individuals somehow get involved in this? You had mentioned earlier something about coaching. Tell us a little bit more about that.
Sure. And as you're alluding to, we are starting a pilot program for activity coaching, and we need qualified coaches. So if you have a certification in exercise and fitness and also have supplementary education, for example, motivational interviewing, or you're certified as a coach through a credible organization like the International Coaching Federation, we'd love to hear from you because we're looking for people to volunteer some time, those 4 sessions to start with. But patients really like that relationship. They can choose to continue on in a coaching relationship with their coach, and that's sort of a separate business relationship from Prescription to Get Active, and or group coaching. If you have skills and qualifications to do the group coaching to help people get more physically active and sustain that activity, then absolutely, we'd like to chat with you about that as well, because it's really groundbreaking stuff, I think, in our industry to start to integrate coaching, that skill of coaching, with exercise behavior.
Amazing. I'm just envisioning here individuals that are perhaps scared to do exercise, that have never stepped foot in a gym, wouldn't know what to do or where to go to get the assistance, hearing about this program, speaking to some friends that they feel comfortable with, and going down this journey together. And they could even do it from the comfort of their own home, because you mentioned that there's virtual and there's opportunities for in-person as well. I don't see any downside to this program. I think that this is so important that we need to shout this from the mountaintops. We need to get people understanding this. So you mentioned the website. It's prescriptiontogetactive.com. And are individuals able to find your contact details there as well, Jeff?
Yes, our contact details will be there in terms of the contact section. So if someone wanted to contact me directly, they can email me at alberta@prescriptiontogetactive.com. And I'd love to hear from people. And, if you need more information, I'd be happy to provide it.
And if you need volunteers to help with some of the other provinces, or if you're trying to get some traction in some other areas, or is there an opportunity for people to come and assist?
That's a hard question, because to start up in other provinces, what we need is a champion, and we need funding, to do those type of things. So what we're learning now with Manitoba is we've got a staff person dedicated. We're working on the funding through a few different channels, but where we initially start is if people have inroads with policymakers within healthcare within those provinces, and know the right people that we need to be talking to do our presentation, to talk about return on investment. The bottom line, for every dollar they put in, they get $3 in return in terms of reduced costs. So that would be some good possibility. If someone knows someone who's interested in supporting through funding of our program, that always helps for us to sustain our operations, but build new operations as well. Again, if they want to be part of this in terms of generating some leads for their business, then they can become members of Prescription to Get Active as well through that process I talked about.
That is fantastic. I'm trying to think if there's anything else that I'd like to cover. And I think it really just comes down to my one final question is there a final piece of advice that you can provide for success to other fitness professionals that are looking to make a difference, aside from anything that we've already talked about today?
I think that the one message that I'd like to send, and we've realized this through our support, the Go Get Fit remote app, and also our activity coaching, is that relationship is key. We're trying to get people not only to start physical activity, but maintain this and make it part of their lifestyle long term. And I'm staring at a chart that I got from Dr. Dawn Morrow, who's done a lot of research around coaching and healthcare in terms of helping people with obesity improve their self-esteem and to get into action and reduce their body mass index, and also people who are smokers to help them kick the smoking habit. The bottom line is that change is hard. It doesn't matter what change it is, and physical activity and exercise is even sort of an octave harder than that, because it takes as we know, it takes effort to do, and that's where you get the benefit from, is in the effort. But in order to manifest that positive change, there's a couple different items that will lead to that. One is your techniques and skills that you use. That accounts for about 15% of someone making change. There's social determinants for change, which those are in the area of safe and stable housing, secure employment, adequate financial resources, positive interactions, those type of things. But the one that really sticks out to me is that 30% of that manifestation is driven by relationship and what your client's experiences in your relationship. Are you treating this as a transaction, money paid for example, personal training, or money paid for membership? Or are you looking at this as a transformational type of relationship where they really know that you care about them, you're not non-judgmental, you respect who they are and what some of their challenges are, and you work with that. 30% is a big number in terms of what you can do in terms of developing relationship that will lead to people's long-term behavior habits.
Brilliant. I'm so sold on this. And in fact, I had mentioned it to a number of ladies that I teach group fitness classes to. They started reaching out about it and sending the information on to their parents and on to their friends. So that just made me so very thankful that this existed, and thankful that I had the opportunity to pass along the information, because I do truly believe in it. Even if it's not benefiting me directly, those people will always remember that I was thinking of them and their loved ones. And that's what really matters at the end of the day. And it's that relationship, as you mentioned.
So there's one other thing that I want to mention, Karen, that we haven't touched on, and that is what's really come to light, especially during the pandemic. Even before the pandemic, this was a big issue, and that is mental health. When I talk to people, especially in government, a lot of times they're looking for some quick wins. And I had to think about that a little bit. And one of the most important wins, especially with mental health, is that physical activity plays an instrumental role in people's mental health in the area of depression and anxiety. And one of the things that I'll share with you is that there's an organization called CanMat. So that's the Canadian Mood and Anxiety Treatment Program. Maybe I butchered that a little bit. Canadian Mood and Anxiety Treatment. So what they have done is these are a group of researchers and also clinicians that work in the field. And what they've identified is that physical activity and exercise is a primary form of treatment for people with moderate to mild depression. And physical activity and exercise is used as an adjunct to support people who have even more serious forms of depression beyond that. So what we do in our industry is really help to reduce mental health issues and help hopefully prevent mental health issues down the road. So it's a hot topic. During COVID, we've seen the level of mental health issues really going up. And it's something that's not just going to end when the restrictions get lifted. There's far-reaching effects of this. And so as a fitness and wellness professional, just knowing that and understanding that is important, because what you do has far-reaching effects, not only physically, but also mentally. So it's not that I don't think people are aware of that, but to the degree that physical activity can support people's, and help treat depression is fairly significant.
I would agree. There's nothing that you just stated there that I would even question. It is undeniable that our friends, our family, our neighbors are all suffering with what's happened over the past 14, 15 months and what will most likely continue to happen for a few more until things get back to fairly normal.
Mm-hmm.
If there's anything that we can do to make the process easier for the people in our lives, I think that it's required. It's something that we should just not even think about and absolutely let them know. And with that, Jeff, I want to thank you so much for being on the show today. I think that this is critical information, not only for individuals, but also as a development tool for facilities and individuals that are interested in making a difference and potentially building some business out of it over the long run. Would you agree?
I would agree. And our goal is to scale this all across Canada, every province, every territory, so people get the benefit of the great work from your listeners, and we can start to optimize people's quality of life and reduce healthcare costs that are really quite out of control.
Let's do this. All right, listeners, you have a call to action, and that call to action is to let people know about prescription to get active. Jeff, thank you so much for being on the show today, and I look forward to continuing this discussion with you another time when we can talk about how it's been rolled out across all of the provinces and territories of Canada.
Great. Thank you for the opportunity.